want to talk now about healthcare because we know that healthcare costs continue to climb. It's really challenging everyone. A lot of people finding themselves struggling to pay for medical expenses that their insurance doesn't cover. So joining me right now, Bobby Rebel. She's a certified financial planner and CEO of Financial Wellness Strategies. Bobby, thanks for joining us this morning.
For having me. I'm going to go work on my golf game when we're done with this. But it's
jealous.
super important I'm a big golfer. It's super important to stay healthy for golf and also for all our friends and families and to stay healthy in general. But thank you for having me.
Bobby, how serious is this healthcare affordability crisis? Would you call it a crisis for Americans right now?
I'm not going to use that word, but it is something that is concerning, especially for North Carolinians. North Carolinians, by the way, Jane, are the 7th highest in the U.S. to report that they did not see a doctor because of the cost. So that is a big red flag. So we'll call it a red flag, not a crisis. But it is something we're concerned about. It's something that we want to give people information so they have transparency and clarity when it comes to their healthcare costs.
All right, so what are we talking about here when people have delayed medical treatments because it's so expensive? That's what I read. And so what kind of consequences are we putting folks at with the healthcare costs rising?
Yeah. So what happens is people don't get the health care that they need, and then the cost will spiral. So it's important to get them the resources that they need to do that. So, for example, a lot of people, believe it or not, Jane, a lot of people, when they walk into their doctor's office, they do not see a price list of what every procedure is going to be. We don't even know what things cost. So, for example, Synchronous Care Credit put together some resources, which include, it's called Fair Financing Principles, but it basically includes things like a procedure calculator. So you can go on the website and you can figure out, wait, what is this going to cost me? And it's not just medical stuff. It's not, it also includes dental stuff, but also things even for our fur babies. I have a dog, her name is Waffles, and I want to know how much that's going to cost if she needs to have a procedure. So you can go and get that information and figure out what things cost and then move forward from there.
So when people are facing a big medical bill, what is the first thing they should do?
Okay, well, the first thing they should do, obviously, is go to a procedure calculator like the Care Credit one and figure out what it's going to cost. But after that, you have to look at your resources. So number one, what is insurance going to pay? Make sure that your doctor codes it correctly so you get whatever you're actually entitled to. See what you have in the bank. Maybe you have an emergency fund. Maybe you have other resources. A lot of people use flexible spending accounts. You can also use a health savings account. But then if you have to finance it, what I really want people to do as a financial educator, as a financial wellness expert, is I want you to go in with open eyes if you were going to use flexible financing. And so you have to understand, for example, what is deferred interest. It's not the same as interest-free, Jane. It's very important to understand that you have to make your payments completely by the end of the promotional period in order to not pay interest. You want to understand that. You want to understand if you go for something like a plan where you can get reduced APR, which means you're going to pay a lower interest rate. That's great, but you have to be making your fixed payments on time. And one of the best ways to do this is to go to something, and it is the Care Credit Fair Financing Principles area, just as a resource, but also you can just look at your bill. But on there, it has an actual, a visual of what your statement's going to look like so that you can see exactly what it's going to be and you can make the right decisions for you. Because I want people to have successful outcomes. I want people to get the care that they need. And it really does concern me that people put off these health care decisions because they simply don't even know. It's just intimidating. They really don't know what it's going to cost and how they're going to pay for it. And I don't want that for anybody.
Yeah, it really goes to show the American financial literacy, how important that is.
It is, and just getting the information that we need, because what happens is when we don't have information, we don't know what we don't know, and we tend to just freeze up. And then we go into this sort of analysis paralysis where we don't know where the information is. I worry because there's sometimes so many sources of information that we don't know what's a reliable source that's going to get straight to the actual numbers, which is why, for example, I love that procedure calculator, because you even put in your zip code and you can see in your area. So specifically, if you're in North Carolina, what does it cost versus if you're in where I am right now, which is New York City? And getting that information, it's a lot less scary, Jane, when you know what's actually happening. You know what I mean? When you have the data.
Yeah. Oh my gosh. Yes, of course. And the prices from North Carolina to New York City, I would imagine, quite big. Beyond
so that's
financing,
going to be good for you. Oh, go ahead.
Yeah,
I'm sorry. Go ahead.
No. Yeah, that is going to be good for us. So beyond financing, what can people think about to prepare for unexpected expenses?
Well, I really love when people, save on a regular basis so that you can avoid taking on medical debt. We don't want that for anyone. So it's important to plan in advance. Maybe you want to take money out of your paycheck on a regular basis and you can segregate different savings accounts. So, it's all fun and games to save for your vacation, but sometimes we don't always save for these medical things. So make sure that you're maximizing your flexible spending account, which may come through your employer. Make sure you're maximizing if you have a high deductible healthcare plan. Make sure that you're fully funding your HSA, and be aware some employers also will give you matching funds for your HSA. So, or even sometimes they even will just fund it. I've heard as much as $750. They'll just put in once a year, and that's money that you can save even going into retirement. So you want to make sure you're prepared in advance and taking advantage of all the plans that you have by getting information.
All right, Bobby.
And making those steps in advance. You get it, Jane.
No, that sounds great. If someone's watching right now, listening right now, facing a medical bill they can't afford and they don't have any of these safety nets in place,
sure.
What do you do?
Well, again, you want to get the information about what resources might be available. And so you can go, for example, to carecredit.com/FFP. That stands for Fair Financing Principles. And it's going to have a lot of resources about how you can pay for different medical costs and specifically how it works, what your responsibilities are. That's very important to me as an educator, that people go in and see the transparency, see the clarity, and they understand so that you get a successful outcome. But we do want people to get the medical care that they need at the time that they need it, because that's the best way to get a healthy outcome, both financial health and your health.
For sure. It could be so daunting, but things that you need to invest just a little time, little knowledge will take you a long way. Bobby Rebell, thank you for joining us. Have fun working on your golf game there.
It's getting better.
Getting better. And what was the name of your dog?
Waffles.
You got to meet Carlene's turkey and waffles.
All right, perfect.
Thank you. Thanks for joining us here in the Live Impact Studio on Zoom as we talk about things that you can do to try to take care of your financial health and doesn't have you asking, where's the money?